Chiang, and I'm a physician and life coach.
I'm Dr. Mary Rensel, physician and life coach. Not a life coach. I coach. I guess a life coach. A professional coach.
Great.
So let's talk about why people go to coaching.
So I would say, at least for me, it's falls in two categories. So you've got your people who are at a low spot, and they know they need to get better, and they've heard that coaching may help.
Okay.
Or if they're actually in a place where they know that they are meant for more and can do more, and they're just not sure how to get there.
Right.
But they might actually have that positive mindset kind of already there. They're just in a I don't know mindset.
Right. And they want to spend some time and strategize which way to go.
Yeah.
Agree with you. Okay, so either poor. So if we coach physicians, do you only coach physicians?
No, I've coached non-physicians.
Non-physicians. Okay. So low spot. So what have you seen low spot? Can you give us some examples, like when people might consider coaching?
Yeah, so burnout's a really big thing, right?
Yeah.
And so I definitely coach physicians on burnout. I'm just, feeling like a cog in a wheel, like, what they do doesn't matter anymore, like feeling lack of respect from patients, the hospital, and administration, all the things.
Yeah. But what if people say, well, how can you change it?
Right, so really it's all about mindset. If you think back to being a med student or maybe a resident, depending on where you are in life, there was always, if you went to medicine, there was that time when you thought, I'm going to help people, I'm going to save lives, or I'm going to impact people positively, I'm going to improve their quality of life. That's what most of us think when we're at least going to med school and residency and fellowship. And unfortunately, some people get burnout as early as residency.
Right.
Really sad.
Even med school, I guess. But so I guess, so the times to think about coaching is if you're feeling like, I thought it would be like this in this position in my job, but it's not. Like, I don't feel like I'm hitting the goals, like personally. You thought you were going to help someone in any role, like nursing or anywhere, you know?
So I think burnout is common with anyone in healthcare, right? Because we're in the profession of caring for people, and there's always this mantra, like the patient comes first.
Yeah.
So you give and give and give, and sometimes you don't have anything to fill up the tank.
Right. And I think coaching is such a great tool to transform that. So again, it might be our mindset. Like, we don't notice that we are really helping people, or we didn't really notice that we're not feeding ourselves. Like, we're not taking time to rest and have fun and connect with others. We're just getting in there and doing our job. So I think coaching can a lot of times help us kind of focus on where we're putting our energy and actually what's important to us, So why, if we're not being intentional with our energy, then we want to tune that up a little bit, and then all of a sudden you find, it's more energetic, you're more energized because you're saving your energy for what really matters to you personally. That's different for everybody.
Right.
If you have a day off.
Just one thing that, I was reminded of recently is that, if I've got a really busy clinic and I see patient after patient, if I just sit and talk to patient only about their medical condition, what they need to do, and just do that again and again, I actually feel much more tired than if I just still take the time, chat with them a little, see how it is, have that personal connection, because that's what really actually energizes me about that relationship, patient-doctor relationship, right? It's not like I'm just treating you as a doctor, is that we're connecting with human beings.
That is so nice, yeah. And that makes so much sense with the brain, because we know, emotions are contagious, and we feed off each other's emotions, and so that is so cool. So it's really like the patient is feeding you, giving you good energy, positive energy, back and forth, and probably asking you about how you're doing, and that means a lot to us as humans, and we have to acknowledge and value that, that interaction. And I think that's the other thing about coaching is people move so fast, they don't really have anyone they're spending a lot of time with and actually being honest and really thinking about their values and what drives them, and I think that's where that can all happen in coaching, which I think is really a special relationship too.
Well, and we worry about what people perceive of us, right? So I coach this one physician who, her deal was she doesn't love her patients, and she just felt like as a physician, she has to love her patients. There are other things that she loved about her physician job, but she just didn't feel like she loved her patients. And I'm like, well, as long as you're providing good care for your patients, you don't have to necessarily love your patients to still be a good doctor.
Right.
And, that realization really kind of changed her outlook.
That helps. Yeah. And so as a physician or any kind of professional, a lot of times you have to have emotional barriers, and that's like where you have emotional barriers, different with, a family member than a client. Obviously, so that's what you have to sometimes reframe those through coaching if you're exhausting all your emotions in one relationship.
And coaching is also nice in that it, is a confidential relationship, so you can say things that you're not going to be worried about, being judged, because the whole point of coaching is to look at your mind and help you see where you're at and where you need to go.
Yeah, absolutely. I love it. Look at your mind, where you're at and where you need to go. Coaching.
Yeah.
Think about it.